Thank you, Amy and Chris, for putting this together, and all of you for joining us tonight. There was a little bit of a scuffle about this seat, not because we don't love Amy, but because somebody has to take the microphone first. So I hope you will all be kind. The lack of laughter is making me nervous. As Amy said, I am a policy person at the Center for American Progress here in Washington, D.C. And I am not actually a political junkie, but I am pretty excited. Hands up if you are excited about last Tuesday's amazing results. Giving us 4 more years to do the work that we have started and that we all know so desperately needs to be done. And the work that I do in health is really informed by the power that health has to tell us what discrimination actually means. What it means when we cannot get a job, what it means when we cannot get the services that we need to stay healthy, what it means when our families or our identities are not recognized. The power that health has is that it shows us that when things are going wrong in the circumstances, the social structures that are supposed to support us, that hurts us. And that's something that people can see. And for better or for worse, people respond to what they know. As we all know, I'm sure many of us from sharing our personal stories. So, with regard to the lens of health and its power for talking about what we as transgender people need, Vice President Biden said recently that transgender civil rights are the civil rights issue of our time. And you can say that that's a lot of empty rhetoric. I happen to believe that it's true. I also think that trans issues are the human rights issue of our time. That's not something that we frequently hear in the United States, but there is, I think, a growing sense, both internationally and here in the United States, that what we are all dealing with is getting screwed over on the basis of gender. Whether we are trans people, whether we are women, whether we are gay people who are told that we are too feminine, too masculine, we're not what people expect us to be. All of us are getting screwed over on the basis of gender. And that obviously has implications for gender identity, it has implications for sexual orientation, for race, for disability, for all of the other things that describe how healthy we are able to be and how we are able to take care of ourselves, take care of our families, and take care of our communities. And what I really hope for from the work that's happening internationally around trans community organizing, around the changing of the World Health Organization's international classification of diseases, which currently lists us as mentally ill. What I hope is happening here in the States with the health reform effort is that what we are seeing is an opportunity to draw together these greater coalitions of people who are aware of the ways that gender has been screwing us over for a long time, who are aware of the ways that gender is a powerful opportunity for us to tell people what we want to see change. And that ultimately will lead us to a place where, in the health reform debate, from a personal perspective here in the US, we will actually be able to get to a place where we are talking about who the trans community is, what we need, how we can get health insurance coverage, how we can use that coverage to get care, and how we can use the resources that we have as trans people to organize our communities and to fight for what we need. And I'm going to pass the microphone down to those who know much more than I about making our voices heard.
So I'm going to ask Andy Miller from the DCTC to speak next, as I would consider Andy our other policy talking head on the panel. So Andy, if you would address what barriers you see in DC when it comes to ensuring that trans people have full access to health care.
Sure, thank you. So what I want to talk about is the way DC law does and doesn't help trans people get some measure of justice if their health insurance says that we won't cover X procedure. So the major tool that insurance companies use to screw with transgender people are these things called transgender exclusions. And these are stipulations in your insurance policy, printed in your policy documents usually, that say that the insurance company won't cover things related to transitioning. Transgender exclusions are applied not only to deny coverage for care-related transitions, which are things like hormones and surgery, but sometimes to keep from covering basic preventative screenings like pap smears and prostate exams, and even sometimes they'll use it to not cover your broken bone getting put in a cast. So they're sick. Before we show what DC law does and doesn't allow transgender exclusions to block, though, I think we should look at, I see 4 types of care that transgender people are going to seek and that insurance might not want to cover for various reasons. So first, there's care that specifically helps a person transition, or what I'll call transition-related care, and that's hormones and surgeries to help you look like another. So then there's what I like to call sex-specific care, which is things like trans women getting prostate exams. Because if you didn't know this, even though I'm a trans woman, I still have a prostate, which might be TMI, but that's a thing. So then there's what I like to call quasi-transition related care, which is stuff that could possibly be connected to transitioning. So increased risk of heart disease or electrolyte imbalances that might result from hormone therapy. Some insurance might not cover that. Then again, some might try to reject my claiming care for things that are transition related. So then there's stuff that has nothing to do with transitioning, but which some insurance companies might try to pass off as transition related, and that's the stuff where insurance companies says your broken arm is transition related, or your cold is transition related, something like that. So what does DC law protect? DC Human Rights Act, which is our banner civil rights law, prohibits transgender exclusions being extended to stuff like broken bones. It doesn't mandate coverage for transition-related care, so you can't use the Human Rights Act to say, pay for my gender reassignment surgery, which sucks. The Human Rights Act would provide discrimination protection for sex-related care, so my insurance company can't deny me a prostate exam. But the Human Rights Act probably doesn't provide protection for that quasi-transition-related care. So if my testosterone blocking pills screw up my potassium balance, which is a thing that testosterone blockers might do, and my insurance company doesn't want to cover my treatment to get better, I might not be protected. So the Human Rights Act provides some redress if insurance companies try to screw you over. Beyond that, there's this text in the DC Code, which is DC Statute Section 31-1603, which we might be able to use to make sure private insurance covers all transition-related care, but there are no implementing regulations, so we're kind of looking into making sure we can use that. So the bottom line is that DC law doesn't provide for trans people getting the panoply of transition-related care, and it should. So figuring out how to do that is a thorn bush that I and some of my friends in the community are starting to look at. So thank you so much for your time.